Through the Digital Regions Initiative, the Australian and Queensland governments are funding the $5.1 million Princess Alexandra Hospital Online Outreach Services project. The project links specialists at Princess Alexandra Hospital in Brisbane with clinicians, GPs, health carers and patients in regional and remote communities in Queensland. Housed within the hospital, the purpose-built telehealth centre uses high-speed broadband technologies to deliver patient-centric healthcare and chronic disease management in areas such as endocrinology, geriatrics, dermatology and cardiology. The centre is enabling the delivery of efficient and cost-effective healthcare of the highest quality to patients living far away from specialist health services, predominantly available in major cities.
When the opportunity came up through the Digital Regions Initiative program to obtain seed funding here at the Princess Alexandra Hospital, the combination of the Commonwealth and state funding allowed us to build a state-of-the-art centre here. The benefits from telehealth accrue across the entire health system. They accrue here because we can deliver services efficiently to rural areas, to individuals in rural communities who don't have to travel 1,000 kilometres for a 10-minute consultation.
The telehealth centre has provided us an opportunity to expand and see patients elsewhere in Queensland. It's quite an efficient process using the telehealth, and we personally run a clinic once a week, and compared with visiting like Mount Isa every 2 months, I can actually see these patients in between times.
It's great for patients and family because they don't have to go to a metropolitan area, they don't have to find accommodation, they don't have to pay for travel. It's not a daunting experience for them.
We're actually a good 2 hours, 2.5 hours drive from Brisbane. So to organise the patients, say with a fractured knob for rehabilitation, for reassessment, they have to go via ambulance. So that's going to cause discomfort to the patient. So this has made life a lot easier. The patient's a lot more relaxed and comfortable here in their own environment.
But the other important dimension of a centre like this in a major teaching hospital is the academic dimension, and that's why we partnered with the Centre for Online Health at the University of Queensland, who are amongst the very best academic telehealth units in the world.
We have a large group of specialists here that are concentrated in this hospital, and for people who live at a long distance, it's either a big journey to come and see them, or the doctors have to travel, and in both cases it's terribly inconvenient. Telehealth does change many things about the way healthcare is delivered. For example, we might have a group conversation amongst a specialist here and a general practitioner at the other end with the patient, something that doesn't normally happen, a three-way chat, because everybody can, if you like, be in the same place at the same time.
This is a wonderful thing, having somebody available each week to review our patients and get that expert care. The geriatrician is online. We can help in goal setting and discharge planning with the whole team. So we have the physios, OTs and all that in the room. And so there's basically a group discussion.
Not only the direct physician-patient contact, but also physician to doctor, and also using our allied health, working with the patients and improving their self-management skills.
Our aim here is to ensure that all the specialties that reside within Princess Alexandra Hospital become available to a much wider community through telehealth.
It does take a change in way of thinking, from both the patient perspective but also from the physician perspective. But I think we've got to overcome that. We've got to appreciate we're saving the patient a great distance in terms of travelling, where otherwise it may take them months and months and months to actually see the specialists, and we're actually being able to deliver a care and get things in place in a good time period.
I just think it's the way of the future. I can see, just in the short time that I've been here, how much our staff and our patients and families and the community in general embrace it.
We're very optimistic about the future, and we believe the integration of it within our day-to-day work will continue to improve. It's going to be a big boon for the patients in rural and remote communities.